Hello, everyone. My name is Trace Board, and today I'll be discussing the United States healthcare delivery system and how it ties to equity issues that are present in the United States today. To start off with the introduction, the U.S. healthcare delivery system can be very complicated when you're looking from the outside in. It consists of a series of different providers, settings, and purchasers who all provide services for the delivery of care. The drive of the system falls on the backbone of three different properties: money, access, and quality, which is further discussed in our Shai and Singh textbook for this course. To better understand how the healthcare system works, it is important to think about and understand what care is received, how it is paid for, and the equitable care that is perceived by the general public. To start off, we'll first discuss providers of this healthcare system. We're talking about physicians, nurse practitioners, physician's assistants, nurses, and pharmacists. Each different provider has unique attributes that help to contribute to this system, which are very valuable. Physicians are responsible for creating a diagnosis and plan of care for our patients. They are seen as the leader in the patient's care and often are credited for helping the patient achieve their healthcare goals. However, there are different reimbursement models for physicians, especially fee-for-service models, that can create incentives to overutilize different patient services and increase healthcare spending, as this is seen with the Brunt article that I have attached in the references. Advanced practice providers, including nurse practitioners and physician's assistants, play a very crucial role in expanding access to care, as they help manage patient care in rural and underserved areas. This is especially seen when there is a physician shortage in a certain area. These advanced practice providers can help fill that void and allow for patients to still have access to the health care that they need. When discussing nurses, nurses are the front line of direct patient care in the healthcare delivery system. Their emphasis tends to be more focused on advocating for the patient and improving some of the patient's social determinants of health. They're also used constructively to provide communication for both patients and the healthcare delivery community, with the focus to be of the patient's best interests. Pharmacists also play a critical role in supporting access to and adherence to patient treatment, particularly in our patients that have chronic diseases that require management using several different medications. They're a source for the patient to receive information about their medications and information required to understand the complexity of their medications. Pharmacists are the most accessible healthcare providers, and they're often the most overlooked providers in direct patient care. So, in summary of the providers of this healthcare delivery system, um, these providers are used to help close equity gaps and as well as provide a backbone for the healthcare delivery system. Although issues like workforce shortages, uneven geographic distribution of providers, and payment models all contribute to unequal access to these providers in the healthcare system. When discussing healthcare's different healthcare settings, the where the actual healthcare is delivered to the patients, there are inpatient hospitals, like the hospital that I'm currently employed at, which is Lake Charles Memorial Hospital. These types of settings allow for acute care for some of the sickest patients in our community. With inpatient healthcare settings like this, costs are very high for patients, and insurance coverage can be an issue for those that are uninsured. Outpatient and ambulatory surgery centers are used in the healthcare delivery system to deliver more affordable and preventative care, with a focus for decreasing disparities in our community. And this is also discussed in my Parshowski article that is attached in the reference. Long term care facilities and nursing homes are also very important for the elderly, as they provide consistent care and maintenance of their chronic health issues while also providing a monitored home where there are healthcare providers to help tend to them. Although, with areas involved in long term care, there is inequity seen due to very high costs and differences in quality of care in these different settings, which is also discussed in the Liu article that I have attached in the reference. Home and community based care models, on the other hand, um, are seen to help improve outcome for our patients by delivering care directly to the community and in the patient's home. If we provide prevention and maintenance with home health care, and community care, this creates a focus on the continuum of care and improving patient outcomes in these communities. To reflect on all of the different healthcare settings, it's important to remember that the type of setting accessible for our patients is usually very specific to their needs, their insurance status, their locations, and their income levels. These factors also can create inequity to exist across the different populations in our community. Now let's take a look at purchasers, or in more layman's terms, the people who pay for our healthcare. There are primarily three categories involved with purchasers. There's government programs, private insurance, and individuals who pay out of pocket. The largest purchaser of healthcare in the United States is the United States government. With the programs of Medicare and Medicaid, these have greatly improved access to healthcare for millions of Americans. However, there exist gaps in coverage and treatment for patients in different income brackets and different low income communities in the United States, which creates inequity with the purchaser. And this is seen in our Artiga article that I have attached in the reference. Private insurance through employers on the insurance marketplace has its advantage to many, as it provides options for people who can afford to have health insurance or have a job that provides health insurance for them. The ability to have a say-so in the type of coverage they desire, and the ability to choose different payment options that best suit them as well. Although it is a small purchaser of healthcare in this system, many look at private insurance for their healthcare needs. However, insurance is still employment and income based, which can lead to some groups being left out of these categories. The individuals who pay out of pocket pay the highest price in the system. Out of pocket payers are seen more in rural areas of the United States, where employers do not provide insurance for their employees, and as well as people who are either making too much or not having a job that qualifies for insurance. And this creates inequity due to the accessibility and affordability already. To relate to the inequities with purchasers, with such policies in place as the Affordable Care Act, there still remains racial and geographic inequity in access that exists to this very day. Okay, and finally we'll discuss, as we have discussed in the previous slides, the healthcare delivery system in the United States is always trying to balance cost, access, and quality. These different variables all have an influence on each other. When one of the three is disturbed, it affects the other two. They must all keep a perfect balance to ensure that the healthcare delivery system in the United States is working as a well-oiled machine. Just to give an example, if you try to expand access to care, this will increase the cost of access, which actually can restrict access to the general low-income public, which has a very negative impact. Improving the quality of the system takes a lot of different resources, and if resources are overused, this will create a disruption in care. The goal of this discussion, as we have highlighted in the course, is to understand that equity in the United States is very important, and without it, the system would cease to exist. We must continue to make changes to adapt to this system by increasing workforce development, expanding telehealth opportunities, and by continuing to make reforms to help promote value in the care for our patients. As nurses, we have one of the most important roles in the balance of equity for our healthcare system. We are the frontline workers involved in advocating for our patients, pointing out these inequities, and establishing and supporting policies that will enhance availability. These are my references, and thank you for listening to my presentation.